Okay, I want to talk a little bit about definitions and types of euthanasia. So we're getting a little more into the weeds here about how euthanasia works, how people distinguish amongst types. This is in a box on the Hope article, page 11. We'll come back to the first definition, which I think is overly broad and is not the right definition of euthanasia at all, but I'll let you know my feelings about that in a moment. But we'll start first of all with types. So you can define euthanasia based on how the patient is involved in the action. So if the patient requests the action, requests to be killed, then that's called voluntary euthanasia. If the patient does not request, that's involuntary euthanasia, and that might be good enough for the two types. Although we can distinguish two more kinds of involuntary euthanasia: the situation where the patient made no request at all. We simply don't know what the patient wants. And the other situation where the patient specifically said, I don't want to be killed, but they were killed anyway. That would be morally outrageous, morally wrong. I don't think anybody would find that justifiable, killing somebody against their will, at least not in a medical situation, maybe in an execution. Okay. So those are three possible scenarios based on how the patient is involved. People also distinguish it based on the type of action. So here we get something that you might have heard of before: passive versus active euthanasia. So an action, an active method of killing somebody using poisons is active. Letting somebody die by inaction, by omission, is called passive euthanasia. Again, I'm going to warn you here. I depends on the situation. If the point of the inaction is to kill someone, sure. But if that's not the point, and we've already seen that there may be other goals or purposes or points in uh, not treating somebody. Maybe they requested not to be treated. Maybe their treatment is extraordinary. And so we are trying to not act in those situations. And to call those euthanasia is at best confusing for people, particularly if people oppose euthanasia. And at worst, it's trying to make your case um, by inaccurate definitions. A third type is based on volition, direct versus indirect. I tell you this, remember, direct means intentional, indirect means unintentional or not part of the intention. Remember, think about the uh, um, doctrine of double effect. Okay. When we get to the definition that I would prefer you use for euthanasia, you'll see that there really is no such thing as indirect euthanasia. Euthanasia has to be intentional, and so the doctor can't be killing somebody cannot be euthanizing somebody without intending it. Okay, so I would just not use this one at all. Okay, now let's get back. Okay, so why make these distinctions? Well, they're somewhat helpful. I would urge caution. They don't solve all sorts of problems. We don't want to do ethics by making distinctions. Okay, but it could be somewhat helpful. Come back to that passive euthanasia. I think that's not helpful at all. It's confusing. There are too many ways to understand inaction in situations of end of life care. Unfortunately, there is a history of organizations like the AMA rejecting active euthanasia but permitting passive euthanasia, which, okay, what are they actually permitting? I think they were permitting foregoing treatment and calling that passive euthanasia. Um, Letting die might not even involve intending death, as we've seen. It's in intending other. It's simply not acting at all. Okay, now let's get to the more important part: definitions of euthanasia. Hope, Tony Hope, seems to think anytime somebody dies in a medical context, it's euthanasia. He says it's intentionally killing a patient or permitting a patient's death. Okay, so if Tony Hope is right, then all these things would count as euthanasia. A lethal injection, well, that's certainly what I would count as euthanasia. Foregoing life-sustaining treatment because I wanted to kill this patient, that probably is euthanasia. And then we get all these situations where we're stopping inappropriate treatment, or we're honoring a patient's refusal. What about removing feeding tubes from a comatose patient? Okay, so there's a lot more complexity involved here, and we don't want to beat the thing with a very vague definition. So what would be a good definition? I propose it as this: the voluntary and intentional ending of a person's life for medical reasons. So euthanasia is a medical killing. Okay, voluntarily means performed freely and knowingly. The doctor knew what they were doing and was free to do it. And intentional means the life-ending action is a means or an end of the doctor's action. Not just that the doctor is aware that the patient will die if they do what they're going to do, but that's part of, when we talk about ends and means, that's part of the intentional process. Okay, when I choose to do an act, I choose to do that act becomes my end, my goal, my purpose, and then I choose some way to achieve that. So I'm saying that definitions matter, and that intentions matter in euthanasia. Okay, intentions play a role in the moral analysis. What was the doctor trying to do? Some ethicists, consequentialists, they reject this in principle because they don't believe intentions matter at all. All that matters, if you're a consequentialist, remember, is the consequences. What's the outcome? Tony Hope, I think, is a consequentialist. He never actually says that, but he seems to think death is death. Doesn't really matter how you got there. If you're killing, if somebody's dying, we got euthanasia. That I don't agree with. Okay, I can accept what people say and I can understand what they're saying that, but I don't agree that that should be considered euthanasia. I want to make more distinctions than they want to make. A justified case of foregoing life support is not a form of euthanasia because death was not the intention or the plan. Passive euthanasia is possible, but not all passive killings are passive euthanasia. Allowing or accepting a death as a side effect is a kind of passive thing. That's the principle of double effect, right? But to call that passive euthanasia is an equivocation. And then again, there'd be no such thing as an indirect euthanasia. You can't have an unintended, intentional death, right? Okay, but foregoing futile or harmful medical treatment where that treatment is life-sustaining, that's not euthanasia. That's not euthanasia. Foregoing life-sustaining medical treatment when an informed patient refuses it, well, that's not euthanasia either. Pursuing a properly consented course of treatment which risks death when there are alternatives that promise more success in keeping the patient alive. Are you in essence killing that patient? Well, again, it's properly consented. It may risk death more than other alternatives, but nobody's trying to kill themselves. I will assume that there's some sort of reason why that treatment was preferred. Setting aside some patients to treat others with more promise of being saved in a triage situation. Somebody can say you're condemning those patients to death, and in a way you are, but that's not euthanasia because it's a triage situation where we're trying to save as many people as we can. And killing a patient by accident should never be considered euthanasia. And here the consequentialists need to actually step forward and make a distinction that they may not be willing to make.